If you've been smoking for a while, you might wonder if quitting's even worth it. Maybe the cravings and nicotine withdrawal just turn you off to the whole idea. You wonder, the damage is done, so does it really make a difference? Absolutely. Your body has an amazing ability to heal itself, and it happens quicker than you think, less than half an hour after you put out that last cigarette. And keep in mind, you're more likely to succeed if you have a plan to handle those cravings, especially in the first few weeks. Smoking releases thousands of chemicals into your body. The result isn't only damage to your lungs, but also your heart and many other body structures. But even if you've smoked for many years, you can reverse these effects and experience health benefits from the first hours you stop smoking to the decades after you quit. Here are some of the amazing benefits that come along with your decision to quit cigarettes. After 20 minutes to 1 hour. As mentioned earlier, smokers are likely to experience impressive improvements in their health just minutes after quitting the habit. For the most part, after 20 minutes, your blood pressure starts to drop back to normal, and overall circulation begins to improve. 8 hours after your last cigarette. Within 8 hours, your carbon monoxide levels will return to a more normal level. Carbon monoxide is a chemical present in cigarette smoke that replaces oxygen particles in the blood, lowering the amount of oxygen your tissues receive. When carbon monoxide goes away, your oxygen levels start to increase to more normal levels. This increased oxygen helps nourish tissues and blood vessels that were getting less oxygen while you were smoking. After 12 hours. At this point, you should be aware that the cigarettes are chock full of harmful toxins including carbon monoxide. Of course, this gas is present in cigarette smoke, and it turns out that excessive inhalation can be incredibly harmful to the body. What's more, carbon monoxide in cigarettes inhibits oxygen from getting into the lungs and blood, and prolonged inhalation within a short time can trigger suffocation. But the good news is, after just 12 hours without a cigarette, the body gets rid of the excess carbon monoxide and improve oxygen levels. After 24 hours. Worried about suffering a heart attack as a result of smoking? If yes, you'll be glad to know that the risk decreases just after 1 day of quitting. Essentially, smoking lowers good cholesterol, which eventually increases the risk of developing coronary heart disease. What's more, smoking raises blood pressure and even increase the risk of stroke. But as mentioned earlier, these risks can be alleviated in as little as 1 day after quitting smoking. Of course, within a short time, the body's oxygen levels increase, making it easier for you to exercise and perform other heart-healthy habits. After 72 hours. 3 days after quitting smoking, the nicotine levels in a person's body are depleted. While it is healthier to have no nicotine in the body, this initial depletion can cause nicotine withdrawal. Around 3 days after quitting, most people will experience moodiness and irritability, severe headaches, and cravings as the body readjusts. After 1 month. In as little as 1 month, a person's lung function begins to improve. As the lungs heal and lung capacity improves, former smokers may notice less coughing and shortness of breath. Athletic endurance increases and former smokers may notice a renewed ability for cardiovascular activities, such as running and jumping. After 9 months. After 9 months of quitting smoking, your lungs will start getting its life back. For the most part, the cilia would have recovered from the harmful effects of cigarette smoke, and you'll notice a significant decrease in the frequency of lung infections. For those who might not know, the cilia are delicate hair-like structures inside the lungs that help fight infections. After 1 year. The risk of heart disease will decrease by half after quitting smoking for 1 year, and arteries and blood vessels will begin to whiten after 5 years. 1 year after quitting smoking, a person's risk for coronary heart disease decreases by half. This risk will continue to drop past the 1-year mark. After 5 years. Cigarettes contain many known toxins that cause the arteries and blood vessels to narrow. These same toxins also increase the likelihood of developing blood clots. After 5 years without smoking, the body has healed itself enough for the arteries and blood vessels to begin to whiten again. This whitening means the blood is less likely to clot, lowering the risk of stroke. The risk of stroke will continue to reduce over the next 10 years as the body heals more and more. Now it's up to you to take the decision and live the super healthy life you've always wanted. Good luck. I hope you liked the video. If you liked this video, then give it a thumbs up and share it with your friends. Thanks for watching.